We have Dr. Sara Cody and Dr. Sara Rudman here to discuss the newly CDC-approved bivalent booster for COVID-19. We will start off with Dr. Cody and then Rudman, and then we will go into questions in English. Following the questions in English, we will move to the Spanish language portion of our program and in other languages. Thank you for your patience, and we will now begin with Dr. Sara Cody from the Public Health Department.
Good morning, everyone. It's good to be with you as always. Today, Dr. Rudman and I wanted to give you an update on the updated boosters, the updated COVID boosters. So as you know, earlier this week, the FDA authorized an updated formulation of both the Pfizer and Moderna vaccines. And yesterday, the committee that advises the Centers for Disease Control and Prevention and the CDC director signed off. So I want to talk a little bit about what that means for our community and for our vaccine operations. These updated boosters are called bivalent because they will protect both against the original Wuhan strain as well as the latest Omicron variant, the BA4 and BA5. The Pfizer vaccine is authorized for anyone 12 years and up, and the Moderna vaccine for anyone 18 and up. And it's important to note that the previous boosters, the previous Pfizer and Moderna boosters have been deauthorized. So we can no longer use those boosters with one exception, and that is the Pfizer booster for the kids 5 to 11 is still authorized. There is not an updated bivalent booster for that age group. So everyone 12 and up who is at least 2 months out from their last shot and who's had their primary series is eligible for this vaccine, this updated vaccine, and we encourage them to get it. I want to talk just a little bit about nomenclature. We're calling this the bivalent booster, the Omicron booster, the updated booster. It's all the same. It means it's the updated formulation to protect against the two different strains, thus bivalent, and importantly, against the Omicron B5. So you'll also hear it called the Omicron booster. What's important to know is that the virus continues to change and adapt, and so must we. We have all changed and adapted our behavior, and we welcome this updated vaccine that's updated to adapt to what's circulating now. As you know, it's mostly been the Omicron B5 variant that we've really struggled with in our community because it's so infectious and spreads so easily. And this new vaccine will give each of us a boost and better protect ourselves. We anticipate that it will protect against infection and will keep us from getting infected and spreading the disease, although we need to really see how this behaves once it's rolled out. And we know that it's going to bolster our defenses and protect us from severe illness, hospitalization, and death. So why, I just really want to emphasize, why is this so important? The fact is that COVID is still with us. When we look at the wastewater data, which is what I look at every day to understand how much COVID is there out there, we're still where we were in late January, early February. That's how much SARS-CoV-2 we're seeing in our wastewater. So it's still significant. And that means it's important to do what we can to protect ourselves and to protect each other. I also just want to say that even though this isn't in your headlines every day, we still see a lot of people in the hospital, and still around 10 to 15 county residents are dying each day from COVID. So it still is having a big impact on our communities, and it's still important to do what we can to protect ourselves. So in addition to staying up to date by getting this updated booster, we also continue to strongly recommend masking when indoors. So masking when indoors, look for well-ventilated spaces, and get your booster. Before I close and pass it to Dr. Rudman, I also just want to switch topics briefly. We know that we're going to have a heat event this long weekend. So please remember to look after those who are most vulnerable, young children, elderly, people with chronic conditions. It's important that they stay in places that are as cool as possible. There are cooling centers that are open around the county. It's also, of course, really important to stay hydrated. So please look out for one another as always, and try to stay out of the heat this weekend. Thanks.
Hi, I'm Dr. Sara Rudman, Deputy Health Officer for the County of Santa Clara. I want to share a little bit more information about the details of the booster coming our way. So we expect to receive shipments of these updated boosters as early as today, and the majority is expected by early next week. Our job at the county is to make sure major health systems receive their shipments directly as expected, and we work to get shipments out to every small provider who's ready to go to give these updated boosters. The county's own vaccination sites expect to be ready within a day to give large quantities of these updated boosters as soon as they've received their inventory. So that's why we encourage everyone who's eligible to go out and get their booster. Again, that's anyone who's more than 2 months past their last shot is eligible to go get this updated booster that will help us fight any surge that may be coming towards us in the fall and winter, because it is such a better fit for the variants that are circulating here right now. The way that eligible folks can access these appointments are by contacting their regular doctor, who may be a vaccination provider. But if they're not eligible to reach an appointment through their regular doctor or don't have a regular doctor, anyone can go to www.sccfreevax.org and schedule an appointment with the county. I'll pass back to Dr. Cody to help answer your questions. Thank you.
We'll now take questions. We'll call on outlets individually. We'll start with PCBS.
And I wanted to clarify one thing. I misspoke. As far as the number of residents of our county who are dying of COVID, it is 10 to 15 each week, not each day. So each week. And you can see that on our COVID dashboard as always. Thanks. Okay.
Yeah, so this is obviously just the latest round of the vaccine rollout. We're kind of all holding hands at this point.
Mm-hmm.
How big of a difference does this make from your perspective in the fight against COVID? How much more confident does this make you to have this new formulation?
So the question is, with this new vaccine, how much more confident are we in our fight against COVID? What difference is this going to make in our fight against COVID? What has been a real challenge with the COVID vaccine is that initially they were excellent at preventing infection as well as hospitalization and death. As time went on and as the variants have evolved and changed, which they have a lot, the vaccine became less effective at preventing infection. So still reduced the chance, but I'm sure everyone here knows people who were fully vaccinated and boosted and got breakthrough infections. If this vaccine does what we anticipate it will do, which is significantly reduce the chance of infection, that really helps the whole community because it will reduce spread. So really important. If it reduces the chance of getting infected and reduces the chance of spread, it will have extraordinary benefit, not just for the individuals who get it, but for the community as a whole.
Carolyn?
I guess just over the summer, a lot of people have mentally moved on from
Mm-hmm.
COVID-19. So how at the county level, or how can we get people to get back on that train, to get vaccinated? They've kind of moved on.
Yeah. So the question is, the observation is that many people mentally have moved on with COVID, and how can we best get people on board with this updated booster? One is, I would say that the media, you all have been phenomenal collaborators throughout this pandemic, and we continue to ask for your help in getting the word out. So I really want to express my gratitude, if I haven't done that already, about how important you are, how important your partnership is in getting information to the public that we all serve. What I would say to people is that this virus is a wily virus. It has changed and it has adapted, and we must adapt too. The tools that we've had to adapt, many of them have been to adapt our behaviors. People are tired of adapting their behaviors. People cannot adapt their behaviors for 2.5 years. And that's why it's incredibly important to have an updated vaccine, an updated booster, that you can get boosted and you can feel more confident that you have protected yourself against infection with the latest strain.
ABC 7. Experts that we spoke with say that this might be the start of that. Every fall kind of flu season, you get the updated strain booster for COVID as well as your flu shot. If that's the case, do you guys anticipate continuing your mass vaccination sites, going forward through this one? And do you think that it might start moving to your general just provider or going down to a pharmacy, things like that?
So the question is around how often will we need updated boosters? Will it be like the flu, and how will the county support that? I think that's your question. I don't know how often we will need updated COVID vaccines, whether it will be just annually, like with influenza, or whether it might be more often. I think the answer to that is we don't know yet. I do know that the county throughout the pandemic has really pulled out all the stops. We want to do everything that we can to ensure that everyone has access to protect themselves from COVID. I can't speak to the specifics about this vaccine operation. I think it really remains to be seen. But I think the county remains very committed to the COVID response.
NBC? In talking to some experts, without being alarmist, but just in analyzing the vaccine, one of the things that they seemed to mention was that the vaccine has only been tested like on rodents or something, and things like that. Sort of giving off the impression to people listening that it's somewhat experimental what's happening here. Can you put it in perspective in terms of to reassure people in terms of how dependable this vaccine can and will be?
Thank you. So the question is around, I think the question is, isn't it true that this updated vaccine, the tests have largely been in laboratory animals? Actually, it's been in laboratory mice. And how do we know that it's going to be safe and effective for people? So it is true, this updated booster has been tested in mice. There's been a small study in humans, a little over 1,000 is my recollection. But this is just the way we do with influenza. So we don't have trials, huge trials every year when we update the influenza vaccine. We don't have huge trials to update the mRNA vaccine. The truth is that this updated booster, it's very, very, very close to the mRNA vaccine that we've been deploying over the last 1.5 years. And so we actually have extraordinarily good data on the safety and efficacy of the mRNA vaccine. And this is a small update, just like the small updates in flu vaccine. So I think I feel reassured. I feel confident in the vaccine, and the pattern really is quite analogous to flu updates.
This booster will be available for a lot of people, and a few months ago we saw huge lines of people going to get the vaccines. Are you guys expecting to open again some of these massive vaccination sites in the county?
The question is, if we anticipate a large demand for the vaccine, is the county going to be opening large sites to accommodate the demand? Yes, we will continue to operate our mass vaccination sites at 3 different locations in the county. Appointments can be found at sccfreevax.org. We don't know exactly when our shipments of vaccine will arrive, but we anticipate mid to late next week that we will have appointments available for this updated booster.
ACS?
about the heat wave. What else can you say about how the county is going to be monitoring the temperatures this weekend and into Monday, Tuesday, and the county's role in keeping residents safe?
The question is around the heat wave and the county's role in keeping residents safe. We have a very well-organized operational area who gets on calls at least once a day, if not more, during any kind of event, including heat events. So the county and the cities and all of the partners, because it takes everybody to respond, and everybody brings their resources to bear. So that's actually going on now. What's important is public communication, so everyone can anticipate that there's going to be a heat event, and do what they can. Identify cooling centers near them, identify friends or family that might be vulnerable, and make sure to check in on them, look out for them, and if necessary, bring them to a cooling center, and be stocked up on water. It's really, really, really important to stay hydrated.
Is it becoming a larger focus for the county with the growing intensity of major heat events? Has this taken on more attention, more resources?
The question is, have these heat events taken more attention and more resources? What I would say is that the county's Office of Emergency Management, this is part of their core responsibility to plan for, coordinate and respond to emergencies, including heat events, and that's what they're currently doing.
We'll take one final question from NBC. This is actually inspired by a call with a friend of mine on my way here when I told him what I was doing. And he said basically, why couldn't they have put this out like a week ago prior to the Labor Day weekend so that people could have gotten vaccinated prior to all these holiday events and crowds that are going to be happening? I know you're not responsible for the timetable, but was there any sort of urging or some sort of idea that maybe it's going to come this close to Labor Day? It could actually be done prior to Labor Day?
So the question is about the timing of the vaccine and why not before Labor Day, a time when many people gather. I can't speak to the timing of the FDA processes and decisions. Of course, there's a committee that advises the FDA. The FDA makes a decision, and then there's a committee that advises the CDC, and then the CDC makes a final recommendation. What I will say is that the details about the timing of exactly when is the most optimal time to get boosted, those aren't out. And usually a few days after a vaccine recommendation, the CDC will produce clinical guidelines. So while anyone who has had their primary series and is 2 months out is eligible for the booster, and we encourage everyone who's eligible to get it, there may be some nuance for when is most optimal, depending on if you've had a breakthrough infection or when your last booster was, things like that.
Thank you, Dr. Cody.
We will now move to the Spanish language portion of our program. We will introduce Maria Leticia Gomez, our Director of Communications and Public Affairs. Following her, we will go with, in the following order in language, Vietnamese, Chinese, and Tagalog. Thank you, everyone.
Buenos días, mi nombre es María Leticia Gómez, soy directora de comunicaciones del Condado de Santa Clara. Tenemos esta conferencia de prensa para anunciar que el Condado de Santa Clara anunció que los centros de vacunación y clínicas locales están listos para administrar las nuevas vacunas de refuerzo Moderna y Pfizer en cuanto lleguen. Como saben, fueron aprobadas ayer por los Centros para el Control y la Prevención de Enfermedades y ya las podemos administrar al público. Las primeras vacunas bivalentes no llegarán antes de la próxima semana y las citas para la nueva vacunación no empezarán a otorgarse antes del miércoles 7 de septiembre. Con la aprobación de la vacuna bivalente, para estar al día con el esquema de vacunación, deberá tener la dosis primaria completa y la vacuna bivalente de refuerzo. Las nuevas vacunas de refuerzo son bivalentes. Esto significa que proporcionan un alto grado de protección contra el COVID-19, ya que atacan la cepa original del coronavirus, así como la variante dominante de Omicron BA.5. El refuerzo bivalente de Pfizer contra Omicron estará disponible para personas de 12 años y mayores. El refuerzo bivalente de Moderna se administrará a individuos de 18 años y mayores. No hay cambios en el esquema de vacunación y refuerzo para los menores de 5 a 11 años de edad. La nueva vacuna debe administrarse tan pronto como hayan transcurrido 2 meses o después de haberse completado la serie inicial o 2 meses después de haber recibido el refuerzo más reciente. Siguiendo la recomendación del gobierno federal, el Condado de Santa Clara dejará de ofrecer los refuerzos originales y solo administrará las nuevas vacunas bivalentes a quienes califican para recibir estos refuerzos. Como saben, la variante Omicron apareció en los Estados Unidos en el otoño de 2021 y para mediados de diciembre de ese año se convirtió en la variante dominante. Las variantes posteriores, BA4 y BA5, aparecieron en Estados Unidos en la primavera de 2022. La directora de Salud Pública del Condado de Santa Clara, la doctora Sara Cody, señala que el nuevo refuerzo bivalente es bienvenido a nuestro arsenal para la defensa contra el COVID-19. El virus continúa reinventándose a sí mismo, sigue mutando, y nosotros debemos seguir adaptando nuestra respuesta con vacunas actualizadas. Con estos refuerzos actualizados estamos muy bien preparados para protegernos a nosotros y a nuestra comunidad y también para salvar vidas. Dejó de hacer titulares en los medios de comunicación, pero en el Condado de Santa Clara, cada semana mueren entre 10 y 15 personas debido al COVID-19. Seguimos teniendo muchos muertos y se puede prevenir vacunándose y teniendo los refuerzos todo al día. La accesibilidad a este último refuerzo es crítica para interrumpir los niveles de transmisión de esta variante en la comunidad. Esperamos que con los refuerzos bivalentes de Pfizer y Moderna podamos mitigar los contagios de COVID-19 durante el otoño y el invierno, cuando se producen más casos debido a que dejamos de estar al aire libre y nos movemos al interior de las viviendas. Repito, recomendamos que todas las personas que califican contacten a su médico de cabecera para ponerse el nuevo refuerzo bivalente de Pfizer o Moderna. Y recuerde, si usted no tiene un médico de cabecera, si no tiene cobertura médica, no hay problema. El Condado de Santa Clara sigue ofreciendo estos refuerzos de manera gratuita y sin importar su situación migratoria. Simplemente visite la página www.sccvacuna.org a partir del miércoles 7 de septiembre. Muchas gracias. Seguimos con, ¿cuál idioma? En vietnamita. Muchas gracias. Thank you.
Kính thưa quý vị, chúng tôi là Philip Huỳnh, nhân viên truyền thông quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay, quận hạt Santa Clara cho biết các địa điểm tiêm ngừa hàng loạt và trung tâm y tế địa phương đã sẵn sàng để tiêm liều hỗ trợ lưỡng trị mới của Moderna và Pfizer sau khi nhận được thuốc. Quận hạt dự đoán loạt thuốc sẽ được chuyển giao vào đầu tuần tới và việc tiêm ngừa không thể bắt đầu sớm hơn ngày thứ Tư, 7 tháng 9. Với sự chấp thuận của loại thuốc tiêm ngừa lưỡng trị, định nghĩa của việc cập nhật về việc tiêm ngừa COVID-19 hiện nay bao gồm việc tiêm ngừa đầy đủ các liều tiêm ngừa đầu tiên và thêm một liều tiêm ngừa hỗ trợ lưỡng trị. Quận hạt đang chờ hướng dẫn chính thức về thời gian tối ưu để tiếp nhận các liều tiêm ngừa hỗ trợ cập nhật trong các tình huống khác nhau. Quận hạt Santa Clara sẽ tuân thủ theo các khuyến nghị của liên bang và sẽ không còn tiếp tục sử dụng loại thuốc tiêm ngừa hỗ trợ COVID-19 nguyên thủy cho những ai hội đủ điều kiện cho liều tiêm ngừa lưỡng trị. Không có sự thay đổi nào trong việc tiêm ngừa hỗ trợ COVID-19 cho nhóm tuổi từ 5 đến 11. Cả hai loại thuốc tiêm ngừa đều có tính cách lưỡng trị và sẽ bảo vệ được nhiều hơn để chống lại COVID-19 bằng cách nhắm vào chủng siêu vi khuẩn ban đầu cũng như biến thể BA.5 của Omicron hiện đang nổi trội. Biến thể Omicron xuất hiện lần đầu tại Hoa Kỳ vào mùa thu năm 2021 và trở thành biến thể nổi trội tại Hoa Kỳ vào giữa tháng 12 năm 2021. Các biến chủng phụ BA.4, BA.5 của COVID-19 xuất hiện tại Hoa Kỳ vào mùa xuân năm 2022. Bác sĩ Sara Cody, viên chức y tế và cũng là giám đốc Sở Y tế Công cộng hạt Santa Clara đã tuyên bố thuốc hỗ trợ lưỡng trị này là một bổ sung đáng hoan nghênh cho kho vũ khí chống phòng thủ COVID-19. Siêu vi khuẩn tiếp tục tự tái tạo và chúng ta phải tiếp tục điều chỉnh việc đối phó với các loại thuốc tiêm ngừa được cập nhật. Với các loại thuốc hỗ trợ được cập nhật này, chúng ta sẽ vững vàng hơn trong việc bảo vệ chính bản thân, cộng đồng và cứu sống được nhiều người. Có được liều hỗ trợ mới nhất này có thể là một yếu tố quan trọng để làm giảm mức độ lây nhiễm trong cộng đồng, chống lại biến thể nổi trội mới. Bác sĩ Jennifer Tong, viên chức phó giám đốc Trung tâm Y tế Santa Clara Valley Medical Center cho biết, hạt Santa Clara cam kết sẽ nhanh chóng sẵn sàng tiêm liều hỗ trợ lưỡng trị cho cộng đồng. Chúng tôi hy vọng là thuốc ngừa này sẽ làm giảm bớt việc lây nhiễm cũng như các tác hại có thể xảy ra khi các đợt bùng phát vào mùa thu và mùa đông. Tất cả mọi người được khuyến khích hãy tham khảo với bác sĩ gia đình về việc tiêm liều hỗ trợ lưỡng trị chống Omicron. Những ai không có bác sĩ gia đình hoặc có khó khăn để lấy hẹn tiêm ngừa có thể vào trang www.sccfreevax.org để lấy hẹn. Xin cảm ơn quý vị. And now Benny Chen with the segment in Chinese.
您好，我是圣塔克拉县县政府的 Benny Chen 张志斌。圣塔克拉县县政府今天宣布，县府所辖的大型疫苗接种站与本地的诊所都已经准备好迎接最新的莫德纳和辉瑞针对新冠变种病毒所研发的2价疫苗加强剂，也称为更新版的加强剂。这个更新版的加强剂预计下周到货，而下周一是劳工节假期。所以施打的日期预计不会早于9月7号星期三。这2种疫苗都是针对原始的新冠病毒株以及目前占主导地位的 Omicron BA.5 谱系的变种病毒株所制作的所谓的2价疫苗，将可以提供更高等级的防护。根据联邦食品药物管理局 FDA 的解释，所谓的2价疫苗就是包含了病毒当中2种 mRNA 的成分。而这一次的2款新冠肺炎的更新版的疫苗，包含的2种 mRNA， 一种就是原始的病毒株，另外一种则是 Omicron 变体的 BA.4 和 BA.5 谱系的病毒株，因此可以同时的对原始新冠病毒和2种目前最流行的变种病毒产生一定程度的防护作用。这一次通过紧急授权的2种更新版加强剂当中，辉瑞的加强剂要年满12岁才可以接种，莫德纳加强剂则需要年满18岁，所以5到11岁的孩童的状况不变，目前还是没有加强剂可以接种。而随着2价疫苗的获得批准，新冠肺炎疫苗的最新定义就包括了完成初始系列，也就是前面2剂，还有接种1剂2价的加强剂。至于接种2价的加强剂的时机，则是在完成第1剂的疫苗，不管前1剂的疫苗，不管是您完成了前面的初始系列，或者说也完成了之前的加强剂都一样，是在打完前1剂疫苗之后要间隔2个月。另外，圣塔克拉拉县也将会按照联邦政府的建议，不再提供旧版的新冠疫苗的加强剂。关于这2款更新版的加强剂在人体实验没有完成的情况下取得紧急授权是否会有疑虑方面，诚如刚刚 Dr. Cody 所指出的， FDA 和联邦疾病预防控制中心 CDC 也都表示说，紧急授权主要是为了因应即将来临的秋季跟冬季可能出现的新一波的大流行，而我们每年施打的流感疫苗也都只是更换部分病毒株，而没有每一次都去做人体实验，这个原理是一样的。因此，这2款2价疫苗的加强剂，它的安全性 ，Dr. Cody 是对它有信心的。在此鼓励您都去咨询您固定的家庭医师，看看您是否适合去接种这一个更新版的2价新冠疫苗。而如果您没有家庭医生，或者是在预约接种方面有任何困难的话，都可以到公共卫生局的新冠疫苗注册网站去预约，网址是 www.sccfreevax.org www.sccfreevax.org。 另外，您也可以上网 sccgov.org/covid-19 查询新冠疫情的相关讯息。最后，也建议您在公共场合持续的戴上口罩。祝你有个美好愉快的劳工节假期。Next, my colleague Sherry Ann will provide a statement in Tagalog.
Magandang umaga po sa inyong lahat. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer dito sa Santa Clara County. Nakahanda na ang County ng Santa Clara na mag-umpisang magbigay ng bivalent COVID-19 booster sa sandaling dumating ang mga supply. Nag-anunsyo ngayon ang County ng Santa Clara na ang mga lokasyon ng pagbabakuna sa masa at mga lokasyon na klinika ay nakahanda ng magbigay ng updated na Moderna at Pfizer bivalent COVID-19 boosters sa sandaling dumating ang mga supply. Ang mga shipment ay hindi inaasahan na maihahatid hanggang sa susunod na linggo na may pagbabakuna na magaganap ng hindi mas maaga kaysa sa Miyerkules, September 7. Parehong mga bakuna ay bivalent at magbibigay ng mataas na antas ng depensa laban sa COVID-19 sa pamamagitan ng pagtutok sa orihinal na katangian ng novel coronavirus, pati na rin ang kasalukuyang nangingibabaw na Omicron BA.5 variant. Ang Pfizer Omicron booster ay available para sa mga taong nasa edad na 12 at pataas, at ang Moderna booster ay available sa mga individual na nasa edad na 18 at pataas. Walang pagbabago sa COVID booster shot para sa 5 hanggang 11 taong gulang. Ang Omicron variant ay unang nakita sa United States sa taglagas ng 2021 at naging nangingibabaw na variant sa US sa kalagitnaan ng Disyembre 2021. Ang mga kasunod na BA.4 at BA.5 variant ng COVID-19 ay nakita sa United States sa tagsibol ng 2022. Ayon kay Dr. Cody, Health Officer at Public Health Department Director para sa County ng Santa Clara, itong bagong bivalent booster ay karagdagan sa ating arsenal na depensa laban sa COVID-19. Ang virus ay nagpapatuloy na muling nililikha ang sarili at dapat tayong magpatuloy na ayusin ang ating tugon ng may updated na mga bakuna. Ayon pa sa kanya, sa pagdaragdag ng mga updated na boosters, nasa mas malakas na posisyon tayo para protektahan ang ating mga sarili at ang ating mga komunidad at iligtas ang ating mga buhay. Ang availability ng pinakabagong booster ay maaaring kritikal na bagay na mahalaga sa pagpapababa ng mga antas ng pagkakahawa ng komunidad laban sa mga nangingibabaw na variant ngayon. Hinihikayat ang lahat na kwalipikado na kumuha ng bakuna. Para maging up-to-date sa bakuna, kumuha ng Omicron booster sa sandaling available ang mga ito. Hinihikayat ang lahat na makipag-ugnayan sa inyong primary physician tungkol sa pagtanggap ng bakuna na bivalent Omicron booster. Ang mga walang primary healthcare provider o nagkakaroon ng kahirapan na makahanap ng appointment ay maaaring pumunta sa www.stcfreevax.org para sa inyong appointment. Maraming salamat po.